I'm really passionate about nursing. I've always wanted to be a nurse. I've always wanted to help people. And throughout my last 10 years of being a nurse, I've sort of learned a bit more about the litigation process and when things go wrong. So when I joined Slater and Gordon, the image that I had was that I'm continuing to help people with my knowledge and my skills of a nurse, but I'm helping them in a slightly different way so that they can get justice and compensation for when something has gone wrong.
I love being part of a team where people are all striving for something where they can go forward and get more. People have suffered, so we're going to get more for them for their future, to make their futures better. Being part of our team means that I can have an impact on that and hopefully contribute to someone else's future.
I am a registered adult nurse on the NMC register, so I advise on everybody from young children, first year of life upwards, to elderly people coming towards the end of their life.
So I work within the maternity area, so we look at antenatal, birth and postnatal cases. I also look over child development issues, and we also look at cerebral palsy cases as well. So we look at the whole continuum of childbirth and the early years as well. I've got a qualification in health visiting, so I sometimes look at other cases, including that as well.
Originally, you sort of get the details and you think that it's going to have one particular set of outcome, but you look into the medical records, you look into the evidence that you have, and actually you identify that there are several other different points to the case that are worth investigating more than the central point that was originally brought to your attention, and then that expands the case beyond what you originally thought it would be.
So I'm really proud that I've actually fitted in really well into our team. We've got a really nice team of registered nurses and midwives. We work really well together. We work alongside paralegals, and we support them and on their journey towards becoming solicitors. And we're just part of being a massive team who all support each other in helping clients get through their journey a bit quicker, I suppose, and maybe pointing people in the right direction.
Part of my role includes training and delivering clinical expertise and knowledge to solicitors, fee earners, other support staff, paralegals. I find it really enjoyable, and I'm really proud of the amount of resources that I've created to help train our solicitors to help them with clinical negligence cases. As part of that, I've developed a medical manual in cooperation with our midwives to encompass any type of clinical negligence claim, and that there is advice and clinical knowledge and evidence within that to help as a reference point.
So part of being a midwife or a health visitor is about being compassionate and understanding that other factors might come into things, so the emotional factors, it's not always clean cut, and reasons why things happen might not be necessarily the reason why it's caused things. So it's just having that extra insight and knowing that we understand and we've been there as well. We've been in them circumstances, we've been on the wards or in community, and we've worked in these scenarios. So I feel like it really gives clients a better oversight to say, look, this is why things may have gone wrong, and this is why things might change in the future, or this is the most available evidence, the best evidence, and we're up to date with all that. So I feel like that's what we can give our clients.
I think they say mainly that having a registered nurse who is still within clinical practice to be involved in the clinical negligence claim, they feel confident that we know what practice is up to date, what should be happening, what the relevant guidelines are when they are updated, what should be done. And I think that's really helpful for us to provide that service to our clients so that they know they've got the best service from us by having in-house clinicians.